So welcome to Keep Your Arms Moving Upper Body. This is part of our dance injury prevention webinar series, Break It Down with the Experts. So tonight we're going to discuss the prevention and treatment of upper body injuries such as tendonitis, rotator cuff tears, and even more. And these injuries can be seen in any type of dancer, so we can get into more specific types of dancers tonight if people have questions about that. And our speakers today are HSS sports medicine physician, Dr. James Robinson, and HSS occupational therapist, Dr. Aviva Wolff. So we are all set to get started. I am just gonna end this poll here. All right. And let's get started with, can you tell us a little bit about the most common upper body injuries that you guys see in dancers and just kind of some, shoulder anatomy and things so that we can get a good picture in our head of what you're talking about? Oh, I think you're muted, Dr. Robinson.
Sorry, I'm going to share my screen so you can kind of see this picture. And so here in this picture, it's kind of got the basic shoulder anatomy. So the shoulder is a ball and socket joint. So the ball is made up of the humerus, the big bone in your upper arm. The socket is called the glenoid, and that's part of your shoulder blade. And so if you look at this little picture down here, the glenoid, think of it as very shallow. So kind of think of it like a golf tee turned on its side. There's not much depth to it. And so you have this ring of cartilage and ligaments that's referred to as the labrum and the capsular ligaments that kind of help hold that ball in place. And then you're surrounded by muscles. There are 4 what are called the rotator cuff muscles. So the top one is called the supraspinatus. And then you have 2 in the back called the infraspinatus and the teres minor. And then 1 big one on the front called the subscapularis. The shoulder blade also has this hook that comes up from the back called the acromion, and that meets with your collarbone to form your AC joint that sits over your shoulder. The other really important anatomy that's not on this slide is your biceps tendon. So your biceps has 2 tendons. One inserts here, and that's the short head of the biceps. That's the one that most people think about when they think about biceps. That's the one that you curl, and most people think about when they think about biceps. But the biceps also has the long head of the biceps, and that comes up here in the bicipital groove, and it inserts onto the top part of the shoulder joint, right onto that superior labrum right there. And that's really important because that can be a common place for injuries and pain.
All right, so that's a great place to start. Aviva, is there any most common injury that you've been treating?
Yeah, so the most common the most common injuries that I see in dancers are probably related to some kind of muscle imbalance between the scapula and the shoulder. So I'm thinking maybe I'll just continue. I'll give a brief explanation of what that is. It's the shoulder blade and the shoulder blade muscles. Let me. Am I able to share? Yeah, I'm able to share my screen, right? So
yes, you should be able to.
I'm going to share my screen and just do a tiny bit on the scapula, just to explain what that means. So if you look here, you'll see that the shoulder blade kind of sits on the rib cage. And as Dr. Robertson just explained, there's that glenoid fossa, which is part of the scapula, where the arm bone, the humerus, inserts. And when you lift your arm up, part of the motion comes from that glenohumeral joint, but then part of the motion also comes from this shoulder blade moving across the rib cage. So it kind of moves in an arc. And 30% of your arm motion comes from the shoulder blade moving on the rib cage, and the rest of it comes from the shoulder moving in that ball and socket joint. The reason this is so important in dancers is because I like to think of the shoulder blade muscles as the core control for the arm. So just like you do core stabilization exercises for your spine or for low back pain, you need to have really strong stability here for your arms and for your arm strength. For dancers, both classical dancers, where the arms have been used primarily for posing and for gestures, these muscles have to be really strong just to support the weight of the arm. For more contemporary dance, it becomes even more important because some of the floor work is really demanding and you need a lot of stability there too. So what you can see here, so that's kind of the anatomy, and you can see these muscles here. Now, when you overuse a lot of the forward muscles to do certain movements, what ends up happening is the muscles in the front can get tight, the muscles in the back or on the side can get weak, and that causes the shoulder blade muscles to jut out. And, you know, we refer to it as winging because it looks a little bit like chicken wings. It's not a super professional term, but it is a clinical term. So when you see that, this is an extreme example, but when you see the shoulder blades jutting out like that, that tells us that these muscles are weak and they're not sitting on the spine the way they should. So that's kind of, I'll stop sharing my screen. That's kind of important and an important basic premise in having strong and stable upper extremities. The other injury that I see more frequently with the dancers who do more of the contemporary work and the demanding floor work is I've been seeing lately more wrist injuries actually from either like a lot of like weight bearing on the arms or sudden torquing. So that's another area that I tend to see dancers for. So we can get into kind of some of the more specific injuries as we go along, but those are the two main areas.
Okay, great. So if we're going to go into, you know, most of these injuries that you guys mentioned, let's start with tendonitis. So what is tendonitis? You know, what are the best ways to treat it? And then how can dancers try to prevent tendonitis as well?
So tendonitis is a term that's kind of commonly used to refer to as inflammation in the tendon. That's what, when you see itis in medical terminology, it usually refers to inflammation. It's actually kind of a misnomer because we know that most causes of tendon pain are not actually due to inflammation. So the term tendonitis is kind of a misnomer. There's not a lot of inflammation in there. So usually the kind of term that's replaced it is tendinopathy or tendinosis, which kind of indicates like chronically diseased tendon. And that's what we know with these chronic kind of tendon issues is that over time, the tendon tends to degrade. And a tendon, so first of all, a tendon is the structure that connects the muscle to the bone. So where the muscle attaches to the bone, that is called the tendon. And in normal tendons, they're very tightly packed fibers. So think of like a rope that has a lot of like tightly packed fibers in it. And that is like a normal tendon. But over time, with certain demands and problems, that tendon can get frayed. The fibers can get disorganized. So just like a rope, as you overstrain it or it gets old, you'll start to see fraying, you'll start to see partial tears in it. And then as the body tries to heal those, it doesn't always heal them back with that tight linear packing. It's kind of a disorganized. And so that tendon is no longer as strong as it used to be and can cause issues and problems.
And Aviva, what have you, you know, what do you normally treat tendonitis?
Yeah, so actually, I agree 100% that tendonitis is a little bit of a misnomer. And a lot of the injuries that we see in performing artists are not easily categorized as an inflammation in a very specific area. I tend to see injuries where the pain is not that localized, or it might, jump around a little bit. Like someone will say like, oh, my elbow hurts here, and sometimes it hurts here, and sometimes it hurts here. And they'll come in with a diagnosis of tendonitis, not from Dr. Robinson, but from other physicians. And sometimes I have to spend half the session explaining why it's not a very localized tendonitis. So in the overuse population, what I just like to use the term like overuse injury, or a misuse injury, where there's either like a torquing, or there's just some kind of overuse to the tissue because the muscles are not in balance. And usually when we do our assessment, what I'm really looking for is which muscles are tight, which muscles are weak, and which muscles might be putting a little tension on the nerves, because there's a whole neural system underneath that can also have tension from tight muscles. And this doesn't mean, because people will come in with something that they'll describe as nerve pain. It might be a little tingling, it might be numbness, it might be, and that's very scary to people, because the first thing they think is like, oh my God, I hurt my nerve, it's compressed, like this is the end of my career. Where in fact, it's very normal to have these kind of feelings when the tissue is tight, or when there's tugging in a certain area. So my approach is more like whole extremity and whole body, where we're looking at, the pain might be in your thumb or at your elbow, but what's going on up here that's causing this like domino effect in your arms. And then we'll treat it by demonstrating and recommending stretches to the tight muscles, strengthening to the weak muscles. And then I always say we have a short-term approach and a long-term approach. Like if I'm seeing a performer who needs to get on stage tonight or tomorrow night, we might just come up with how can we tape you in a position that you're comfortable and safe to do the work you need to do for now? And then what can we do long-term to get you on the road to recovery and a better balance?
Okay, great. That should put our mind at ease about tendonitis a little bit. But what are some of the common causes and types of rotator cuff injuries, to switch to a different type of injury in dancers? What are the common types that you see, and are there any strategies to prevent rotator cuff tears as well?
Yeah, so probably the most common thing is a term that generally gets used is called shoulder impingement syndrome. And so what that is we talked about that you have your ball and socket, and then you have that acromion that sits above it, okay? And what happens is when the rotator cuff gets a little weak, your deltoid muscle, the big muscle here on the upside of the arm, starts to take over and do more of the motion of lifting your arm. As it does that, that causes the humerus to ride up a little bit. And then when you lift your arm, it causes that rotator cuff to pinch on the acromion above it. And that's classic impingement called subacromial impingement. And it's very common in people that do a lot of overhead repetitive activity. So in our more classical dancers that spend long periods of time where they may be positionally with their arms overhead for the majority of a performance or something, then they can get that because that rotator cuff is kind of constantly getting pinched on that acromion above it. And as we've kind of mentioned, the problem is not really the rotator cuff itself. It is a little bit because it's a little weak, because it's been kind of chronically injured, but really the real problem is with your shoulder blade and your posture, and how you lift your arm up is why your arm is like pinching up on that instead of staying down and lower so that it grows above it. And so, the rehab and the is involved a lot in stabilizing that scapula, opening that space up. We all do a lot of desk work, and we tend to be very crouched over as we look at our phones all day long. And so it's opening the space back up, getting that nice posture, and then getting those scapulas stabilized. The other problem that dancers particular tend to have is most dancers are very hyper flexible. You know, it's what makes you a very good dancer. And the problem with that is the labrum, that we talked about that surrounds the shoulder, that holds the ball in, can be very loose. And so dancers a lot of times tend to have something that we call multi-directional instability, which means that as their arm moves around, it's not staying stable. It's kind of, that humerus is kind of moving around in there because there's not that tight ligament to kind of hold it in place, because the ligament is a little bit more loose. So for dancers that have that, they have to have very, very strong rotator cuffs and very, very strong scapula stabilizers, or else they are going to get problems with impingement and things, because they're having laxity of that joint as they move their arms around.
And Aviva, what do you typically do when someone comes in with rotator cuff injury?
Yeah, so I also, I just wanted to add, I don't know if there are any ballroom dancers in this group, but that's another population, believe it or not, where we see a lot of impingement, because with the partnering, there's the closed position, which involves that like abduction of the arm and what we call internal rotation. It's more in the male partner where like he's positioning his hand on female partner, and that's a very prolonged position. And in that position, you have like 50% less space in that acromial space that Dr. Robinson just spoke about. So that, you know, again, is just another population that we tend to see rotator cuff injuries, as well as like, as you mentioned, the classical. So depending on how acute versus chronic the injury is, like, did it just happen, or is this something that's been going on forever? We'll approach it a little differently, but generally we start with just simple pendulum exercises to open up the space between the humerus and acromion, and the humerus and the glenoid. And what that means is it's just you have the person leaning over and making small, like using gravity to help pull the arm out of the socket a little bit and create a little extra space by making small circles, and clockwise, counterclockwise, we might swing back and forth or side to side. That's generally well tolerated, and you want to start in a tolerated range. And then from there, we'll move to what we call isometric exercises, which are you're not moving the joint, you're just working on very gentle stability in different planes. And then from there, we'll work on strengthening both the rotator cuff muscles by adding maybe band exercises, making it a little more difficult as the treatment progresses. And most importantly, as we've mentioned many times, and we'll continue to mention, is those scapular stabilizers, the postural muscles, everything that supports the scapula, we've learned over the years is key to having a pain-free and stable shoulder.
And also, like in dancers, you know, a true rotator cuff tear, like a full thickness tear where the tendon pulls off the bone, is pretty uncommon in dancers. It's a fairly uncommon injury. And usually if that were to occur, because most younger people, and I say younger, under the age of 60, as I get over 40, but in that population, it takes a pretty large force to tear the rotator cuff. And, you know, now as we get above into 60s and 70s, sometimes that force doesn't have to be as great. But so usually if a full rotator cuff tear is to occur, it's usually from a lifting injury. So you can see it in partners who are lifting their partner, where they may have a lifting injury, or from a fall. So, falling onto your arm, basically. And when that happens, what you will have is usually there's pretty severe pain, and you have weakness. So like it's not just painful to lift your arm, you really can't lift it. It's very weak. And that could indicate like a rotator cuff tear, definitely something you need to get checked out, because most full thickness rotator cuff tears actually require surgery to fix. They don't heal on their own. And so that's not something that you want to leave for a long period of time.
All right, got it. So I think another, topic that we can talk about is shoulder instability. I know you mentioned this earlier. So if a dancer comes in with shoulder instability, how would you treat it? And I know you mentioned multi-directional instability as well. Can you talk a little bit more in depth about that?
Yeah, so multi-direction, so there's two main types of instability in the shoulder. So there is instability that's there because the anatomy, the normal anatomy of your body is loose and lax and allows for more motion than the average person. Then there's instability that occurs because there's a structural abnormality, such as a labrum tear. So if you have had an injury before, let's say you've fallen on your shoulder has kind of done what we call sublux, which is where it almost wants to dislocate, but it doesn't completely dislocate. And it tears that labrum, that ring of cartilage that's holding it in. Well, now that labrum is loose because it's torn. And so that shoulder is going to be unstable in that direction and want to come out that way. Now, the good news is that for most people even with a labral tear, that doesn't always require surgery, and most people can rehab that. They can work on strengthening their rotator cuff, and the rotator cuff, when it's nice and strong, will take over for what the labrum's supposed to do, and it will hold that shoulder stable and help keep the instability from happening. But now in people with recurrent instability, recurrent subluxation, especially recurrent dislocations, that's something that then we typically talk about more surgical, fixing that labrum, anchoring it back down so that that shoulder's even tightening up some of the ligaments to kind of hold the shoulder better in place so that that doesn't continue to occur.
Yeah, I'd like to add something to, it's related to instability and hypermobility, and that is that in this population of people who are hypermobile, what happens is the ligaments are more lax. The ligaments are the structures that hold the bones together and create the joint along with the joint capsule. The ligaments they don't have great blood supply. So also when there's an injury, it takes longer to heal. But the other thing that lives in the ligaments are the nerve endings that send the signals to the joints and muscles on where your joint is in space and how to, and sends the signal to the muscle to contract. So people who are hypermobile, when the ligaments are a little stretched out, they don't have as dense, the density of the nerve endings that send those messages is less. And because of that, sometimes the awareness of where the limb is in place is also part of what's contributing to the problem. So in the rehab and in the therapy, one of the things that we would focus on, in addition to, what we've already discussed, stability exercises and pain-free movement and all that, is something called proprioception exercises, where we want to increase this ability for the nerves to communicate effectively with the muscles as to when to contract, how to stabilize the joint, and where the joint is in space. And we usually do this by some kind of, we want to get the joint to react. So we might do something that involves like a ball toss, or something that like a body blade where we're vibrating, or so anything to get those muscles to react quickly. We call them like perturbations, or we try to perturb the joint so that it reacts quickly. And you might be given exercises to do like in what we call like a closed chain, where you're like leaning onto a physio ball or pushing into something that has a little give to, again, stabilize those muscles that, to strengthen those muscles that stabilize the joint.
All right, great. So that's shoulder instability. Now, shoulder imbalance. How is that different? And can you speak about imbalance in the scapula and the scapular stabilizer? I know you talked about that a little bit, Aviva, but can we hear a little bit more about that?
Yeah, so I think, I mean, I covered most of what I would say about that in the beginning. Depending on where the imbalance is, we would strengthen the muscles that are weak to rebalance. I don't know if Dr. Robinson has anything to add to what was said previously.
No, I think that was really good. I think one of the things, though, always to remember, we always think about it, and dancers are so busy, and your life is so much, performance and rehearsals and things like that, that you often don't have a lot of free time to do other things. And so the arms kind of sometimes get forgotten because they're not what most dancers think of that they use a lot. And especially when you're, in the classical modalities, if you're not doing a lot of lifting with your partner, then you don't use your arms all that much as from a strength standpoint. Now, you definitely use it from a positional standpoint, but as we start to see, when you talk about modern hip hop, you are constantly using your arms as you get down on the floor, up off the floor, all of those things. And if you don't have strong rotator cuffs, if you don't have strong scapular stabilizers, that's just going to be a recipe for injury as your shoulders start trying to support your entire body weight. That's a lot on the shoulder to do. So if the shoulder's not nice and strong and you haven't laid that groundwork, then it is going to be prone to injury.
Yeah, definitely. And that kind of goes into my next question. Before I say that, I just want to encourage everyone to ask your questions in the Q&A. We're looking forward to answering anything you guys are wondering about. So for those dancers that are really busy, which I'm sure is most of them, they're always in rehearsals and everything. Are there any strategies to avoid those overuse injuries and the pain that they may get from constant rehearsals?
Yeah, the good thing about the rotator cuff is you can work on it usually pretty quickly, so there are a few exercises with bands and things that you can do that you can incorporate into your normal routine, 2 or 3 times a week to kind of help strengthen that rotator cuff. I'm a big fan of planks. Planks are, in order to do a plank, you have to not only engage your rotator cuff, you have to engage your scapular stabilizers as well. So if you're doing a plank with the proper form and not allowing your arms to cave in like that, and you're really using those muscles to help stabilize, and then that's already something that a lot of dancers do as they incorporate their core work and things like that. So just making sure that your upper body has as good a form as your core when you do those type of exercises. Push-ups are another good one. They don't take a lot of time, but they're very, very good for the shoulder because you have to stabilize your shoulder as you're stabilizing your body weight. And the other thing, especially for, like we talked about, for contemporary hip hop, modern, those kind of dances, you're mimicking the moves that you do, which are usually going to be as you kind of go down to the ground. So you're using the muscles in the same way that you would use them during your dance.
Yeah, I'm going to share my screen really quickly to show my 3 simple favorite exercises that targets the scapula for basics. And these are great prevention exercises. So let me just show you quickly. If you look at these 3 positions, basically the model is doing the same thing, which is squeezing the shoulder blades, rolling the shoulders back with the arms at the side, with the arms like out in kind of Superman position, and with the arms overhead. And what you get in this series of 3 exercises is you're targeting all those scapular muscles, the kind of the lower traps that kind of assist with bringing your arms way up, the middle trap and the rhomboids, which stabilize the scapula on the rib cage, And then the one above the head, sorry, that's the lower trap. The ones at your the first one with your arms at your side is again like more rhomboids. But these exercises in particular, great for prevention, great for just having healthy, stable scapula. And then, from there you can progress to doing it weighted, to doing, fancy things with like bands. But if you're like, anywhere you are, you always can just, grab a yoga mat and just do these. And then planks obviously are great. The other one that I like a lot is what we call bird dog. And I can show that really quickly too. For those of you that aren't as familiar, it's this middle photo right here. So we have plank, we have modified planks, we have side planks, which give you good core. I mean, both scapula, but also good core. And then the bird dog, which gives you both. I mean, it's like a whole body workout. So those are some ideas for prevention.
All right, wonderful. I'm going to start doing some of those. And
oh, they're good for all 21st century humans, because we're all in this like forward rounded posture all day, whether it's on the computer or whatever we're doing. So
oh yeah, exactly. All right, so I think we'll do a few more questions, and please ask anything that you guys are looking to get answered. So if a dancer is having, arm or shoulder pain, how can they know when it's time to seek treatment? Is there a way that they can differentiate between just their arm being sore, their muscles being sore, or really having a more serious injury?
Oh, sorry. Rotator cuff and shoulder joint pain is usually going to refer to your upper arm here. So when you have pain kind of in this area, that's often coming from your rotator cuff or your shoulder joint. That's just the way the body's wired. And so most people with rotator cuff, or some people may feel it here, but a lot of people will feel it right here in their upper arm. And so that upper arm pain can be a sign of rotator cuff problems or shoulder joint problems. And I think with dancers, or in this, I kind of use this for any of my athletes, as we all know as athletes, the difference between soreness and pain. Like you're used to being sore after workouts. You understand what that is. You understand that that's kind of normal, and part of being a dancer, being an athlete, is that you will be sore after intense workouts. But like sharp pain while you're doing stuff, that's not the same. That's very different. And if it's fleeting and it goes away, and it's not worsening, then certainly doing some stretches and things and just trying to see if you can kind of get it to calm down on its own. But if it's continuing on for more than a few days, or if it's starting to worsen, especially, so, it used to hurt, 2 hours into rehearsal, now it hurts 10 minutes into rehearsal, that's very, very different. And that's kind of when it's time to start seeking out somebody to figure out exactly what's going on and how to get it better.
All right. So is it bad for a dancer to try to like work through an injury and, keep dancing if they're experiencing, say, that sharp pain that you mentioned, or, can that sometimes be okay if they have a rehearsal?
So, I mean, the answer is yes and no. So, certainly there are certain things that are just painful. They're not necessarily dangerous. And, as we try to treat them, it's more of a pain control issue. And so there are certain kind of pains that you can kind of work through and try to dance through and things like that. But then there are certainly things, especially when it comes to the shoulder, that you could do long-term damage to your shoulder by continuing to try to participate. So one of the things that I talk about a lot is instability. So instability can be a major problem with your shoulder. You can do major permanent damage to your shoulder by continuing to have instability events. So, if you feel like your shoulder's popping in and out of place, like that is not normal and that's not okay. And you can do damage to the cartilage of your shoulder. and some of that can't always be fixed, you know, and can predispose you to get a bad arthritis. But, you know, certainly, you know, there are some rotator cuff type pain, you know, and some rotator cuff tendinosis that you can kind of dance through. But I usually tell people, if you're having sharp pain while you're doing things, there may be a point that you can dance through it, but at some point that's going to stop happening, and the pain's going to stop limiting you. And when you wait to see me when the pain's limiting you from doing things, and then I have to tell you to stop dancing for a little bit. But if you come and saw me like 2 weeks ago when it was just, then we may not have to tell you to stop dancing. We may be able to fix it while letting you continue to dance and rehearse and things like that. So I think that's part of the problem is, you know, I treat a lot of runners as well. And I think their communities are very similar personalities. And a lot of runners are like, oh, I don't want to go to the doctor because they'll tell me I have to stop running. And I'm like, well, if you wait until the pain's so bad you can't run, then yes, the answer is going to be to stop running. Same thing, if you wait till the pain's so bad that you physically can't get through a rehearsal because your, you know, pain's so bad, then yes, then they're probably going to tell you to take a break. But if you get to us beforehand, then a lot of times we can fix it without having to have significant time off of dancing.
Yeah, and the one thing I will add to that is I mentioned earlier that I'll see occasionally wrist injuries in dancers, particularly those who are doing some like sophisticated floor work or intense floor work. And that's one area where if there is like some kind of sharp wrist pain, it's probably not a good idea to keep loading the wrist. There may be an injury that needs to heal. It could be a ligament injury as well. And sometimes the nerve in the carpal tunnel could get irritated. So those are the kind of injuries that you probably don't want to work through. But I've also found I consult for Juilliard, so I see some of the dancers there, and often like the choreography can be like accommodated slightly if there is an issue for a particular student. Like a lot of teachers are pretty understanding of those sort of things. So there are solutions. Like not all injuries mean, you know, you have to back out of your commitments, but you know, we always want, you know, safety first and health first, but we understand the commitments and responsibilities of professional and student performers.
The other thing that's great about treating dancers, and one of the things I like best about treating dancers is dancers as a whole are very in touch with their bodies. They're very in tune with their own bodies and understand what's going on. So, you know, I tell my dancers a lot of times, use your instincts. If you think something's probably, you know, if you feel like something is wrong, something's not right, then it probably is, and it's probably time to see somebody about it and get it looked at. Because I mean, dancers are very in tune with their bodies and understand when something doesn't feel right. And so just trust your instinct, trust what you feel. And if you know, pain is your body trying to tell itself, look, you're doing something that is damaging. And so it's just your body's way of saying, hey, we need, and that doesn't necessarily mean you can't dance. It just means we need to, you know, something's going on. We need to switch it up, you know, switch it around a little bit.
Okay. And Aviva, I was curious, are there any exercises that you recommend for those wrist injuries, like to kind of strengthen the wrists and keep them stable? Oh, I think you're muted.
Oops. So there are wrist stability exercises that can be done. But more importantly, actually, is, you know, the position for weight bearing. And there are ways to push up on your hands so that you're not transmitting as much force through your wrists. And some of that involves like cupping or using the balls of the these joints, we call them the metacarpal joints, but using the balls. So if the pressure is here and here, the load distribution is better distributed than going right through the wrist joint. So those are like some techniques that we can show people. And I should say that if somebody does have an injury, sometimes you can do like, there are modifications that you could do to pushing up, whether it's like using a fist, so you don't have to go into the full, or using blocks, or sometimes using the forearms to plank instead of to push up. So there are some modifications, but stability exercises are best done with the wrist in a neutral position, and then strengthening the muscles that support the wrist from all sides. So that's generally the approach we'll take for prevention.
Okay, great. And I wanted to add in one more question. So are there any specific warm up and cool down exercises that you would recommend to try to help prevent these upper body injuries for these dancers?
Yeah, so it's a great question, because I work with a lot of musicians as well, and musicians, unlike dancers, are not very tuned into their bodies as a generalization. So the warm up is like not so intuitive, like a physical body warm up and stretches are not always intuitive to musicians. Dancers, I feel like they're always warming up before they dance. They're always stretching. So they need less of that as a prevention. And usually the warm up and stretching that they're doing is more tailored to the work that they're doing. So it's appropriate for them to do that. So I rarely have to give, customized warm up and stretches, unless obviously there's an injury and then we're trying to, prevent re-injury. The exception to that, again, is many people have very tight pec muscles. Again, especially if they're, if you're partnering and you're doing lifting, like those are going to be tight. So one stretch that I like for like everyone is just like lying on a foam roller with the knees bent and just opening the arms to open everything up. That's always a really nice stretch. That just feels good. For the arms specifically, there are two. I mean, I'll put myself sideways so we can demonstrate better, but they're the muscles on this side, which are our extensor muscles, and the muscles on this side, which are our flexor muscles. So with the arm straight, a good stretch is to just have the elbow straight and the wrist bent. That gets your extensor muscles, and then the reverse, for the flexor muscles. So that's one that may be a little less intuitive to dancers. But
Also, I think,
yeah, go ahead.
Go ahead.
I was just going to say, in terms of like warm up and like a cardiovascular warm up and all that, I mean, they're getting that, from their usual whatever warm up routine that they have.
I also would say is, over the last probably 10, 15 years, we've really kind of changed the way we think about warm up and stretching and getting ready for exercise. And so now we tend to favor more what are called dynamic stretches. So that's movement-based stretching exercises. So, when I was in high school and playing, sports, we all got around in a circle and we, touched our toes and counted to 10 and then came back up. And that's just not, that's not a functional movement. That doesn't really warm your body up. And so for the shoulder, when you talk about it, so things like swimmers, so just, initiating like a swimming motion, getting that rotator cuff warm, getting that joint capsule warm. So as you warm up and move your joint, as the body's kind of natural protective mechanism, it starts to increase the synovial fluid, which is the lubrication of the joint, and gets all that stimulated. It gets blood flow going in there. As we were mentioning with the scapula, so doing chest openers, like coming up like this, bringing it back like that, like stretching out those pecs, getting it going. And then like, I love sun salutation as just a good full body stretch. You get everything moving, just kind of get it going. And then when you talk about the static stretches, that's more kind of an after activity or on off day kind of thing. because the main point of static stretching is to stretch, stretch things back out, lengthen things back out. And that's not something you necessarily want to do right before you go to a 2-hour, 3-hour rehearsal or a performance where, where you really need those tendons and muscles functioning at a high level.
Yeah.
All right, wonderful. Unless you guys have any last words for, dancers and how they can keep their upper bodies strong and healthy and protected. Do you guys want to say any last comments? I think we covered a lot, but Aviva.
Yeah, I mean, I think I'll close with something that I tell all performers about injury, and that is don't freak out. The body is a healing machine, and the body really wants to heal itself. So we're just going to help you get there. But the instinct, I think, for people is, again, to get really worried and concerned about injuries. And I think what I love about treating musculoskeletal injuries is they really heal and get better. So it's a fun area to be in because our patients get better. And I think that, when the stakes are high, it's easy to panic. But if you take a moment back and take a deep breath and get the right kind of help, you'll be back on stage pretty quickly.
Yeah, I think that's great. And I think, one thing that I would leave you with is, like we think about, just don't forget about the upper body, So as a dancer, you're going to focus a lot on your lower body and your core, but don't forget about your upper body, because that is kind of an important part of your job. And then the other thing is, use us. Use your sports medicine physicians, use your physical therapists, use your occupational therapists, use your athletic trainers. We want to get you back. Like, we want you getting back to your job at a very, very high level. We want you to get you back to doing the things you love to do without pain. That's what we like to do. That's why we went into this field to begin with. Nobody went into sports medicine because they like to tell people they can't dance anymore. That's not why we went into it. We want to get you better. We want to get you dancing again. And as Aviva said, like, most things heal. They heal really well. The body is a miraculous machine. It heals itself really well. And sometimes it just needs a little help. And we can provide that help to kind of direct you so that your body can heal itself and you can get back to doing the things you want to do.